Oftentimes we have a patient come to us who has already had a prosthesis for years, and they realize that they've got a fit issue that they'd like to improve upon. And some of the common issues that patients have that can be improved upon are a lot of socket issues or alignment issues too. If you're experiencing some pain at the bottom of your patella, or if you're experiencing pain at the end of your tibia, one thing you can start off trying out is just adding some more socks to see if you've lost volume. If that doesn't work, you may need an adjustment to your socket, or you may need an entirely new socket. Something else that can happen is, as a patient gets their first prosthesis, they have some swelling and edema, and their muscles are still there in their residual limb, but over time that starts to atrophy away and shrink down. The bones become more prominent, and things get a little bit more uncomfortable, and so your body just might have changed to the point where you need that socket to be adjusted significantly or even replaced. One of the other issues that people end up having is they feel some weird pains in their leg, or they feel like their leg's pistoning up and down, and that can be due to a loss of suction. So if you've got some cuts in your sleeves, or if some of the hoses that connect it to a vacuum system aren't working quite right, then air can get into the system and you have a lot more movement than they should in a prosthesis, which really, the way it works, it should be locked on pretty well, and you shouldn't have hardly any movement, which reduces the skin shear, reduces the bones moving and being uncomfortable, and takes away a lot of pain. For more information or to ask us a question, visit bulowbiotech.com.